Hello, everyone. Welcome in just a minute. Welcome, everyone. In just a minute. If you want to go ahead and say hello in the chat box, let us know where you're joining us from. In Florida, Ohio, New Jersey, California, Colorado, lots of Oregon, Missouri, New York, Ann Arbor, that's where I'm from. Hi, Ann Arbor. New Jersey. Awesome, great to see so many people joining us from all over the country. Great. Thanks everybody from lots from New Jersey. We're gonna go ahead and get started. Your phone line is muted. This webinar is being recorded and a link to the recording and slides will be shared later. Welcome to our webinar on operations guidance for summer camps, programs, and childcare. My name is Leslie Cabace-Boston. I'm the Director of Program and Systems Quality, the National Summer Learning Association. Before we get started, here's a quick overview of our discussion today. First, I'll share a little bit about NSLA for those of you who are unfamiliar before we hear from our expert panel. After that, we'll have some time for discussion and audience questions. Then we'll wrap up with some announcements and follow-up. While we're going along, if you have any questions for our panelists, please put them in the Q&A box. We'll be monitoring the chat box as well, but questions tend to get lost in there. So if you have a question that you can ask and answer live, please try to put it in the Q&A box. The National Summer Learning Association is the only national nonprofit exclusively focused on addressing the achievement and opportunity gaps by increasing access to summer learning opportunities. NSLA's goal is to increase nationwide the number of high-quality summer learning programs. To achieve this goal, NSLA recognizes and disseminates what works, offers expertise and support for programs and communities, and advocates for summer learning as a solution for equity and excellence in education. NSLA is driven by the belief that all children who deserve high-quality summer learning experiences will help them succeed in college, career, and life. Core to our work is the recognition that high-quality summer learning programs work and have been shown to improve reading and math skills, school attachment, motivation, and relationships with adults and peers. We know that summer is a time of great inequity for young people, and we believe that promoting and supporting summer opportunities is a way to address this. This goes beyond the summer learning that's in our name. We also want to see programs and communities addressing access to other resources like meals and youth employment. Summer is a time for innovation and exploration. Without some of the constraints of the school year, kids are able to try different ways of learning, interact with other adults and peers that they might not otherwise. This is also a time of innovation for adults, whether that is opportunities for professional development, trying out new teaching methods, or new partnerships. I'm happy to introduce our first speaker, Henry DeHart, Chief Operating Officer of the American Camp Association. Henry?
Great, thank you very much. We also have Gresham Troop, who is the membership manager of the American Camp Association. She's here to, she may feed you some links in the chat, and she's my real-time fact checker. So if I say anything that's not right, she'll jump in and correct me. Thank you all for some time. We are hopeful that we can provide some resources and some information that will help as you think about your summer programs. A lot of our resources are framed around the idea of camp, but a lot of those are day camps, and the principles apply for other youth type programs as well. And a lot of summer learning programs do happen in a camp setting as well. So next slide. Great, so what we wanted to do first is we'll spend a little bit of time talking about some resources that are out there. Then we'll also talk about some of the content, some of the key themes in the content of these resources. And then we're trying to carve out some time to leave for questions later on. So first of all, if you're thinking about a youth program, youth programs and camps, the CDC originally put out what they call a decision-making tool. And Gresham will share that link with you, but this is just a framework to walk through the steps that you need to be able to check the boxes in order to offer programs in a safe manner according to the CDC. So this is out there on the CDC website. One thing I will say about this is very high level. One thing that I will say is that the resources that I will talk about from ACA, they line up nearly perfectly with this decision-making tool. So for each of the items that need a check, there is a resource on our, what we're calling the field guide for camps, that goes into more detail about how you accomplish what's in each of those steps. And so we'll talk about that more in a minute. Next. So the next thing that the CDC put out, there's actually one thing in between the two. You can probably still search it. It's called Activities and Initiatives Supporting the Opening of America, and it has some information about camps too. But most folks, most states, as they're referencing, writing their rules for youth programs, are referencing the decision-making tool, and then this document, which is the considerations for youth and summer camp. So the CDC came up with this as well. It has a decent amount of detail. And they're really thinking about day programs, and then there's kind of an addendum at the end of that for overnight programs. So that's there as well. This is the official guidance that came from CDC. Next. So the American Camp Association has been working to develop a wide variety of resources to help camps as they think about operating this summer. So some of this may not be appropriate to you, and we're hopeful that much of it will. So we'll talk about the camp operations guide, the dark blue box mostly, but there's also a decent amount of other information there too. There's a pretty robust section around mental health resources, and there are some specifics. The health and wellness section links to a lot of these CDC documents and other organizational documents. We have a decent amount of resources we've created, and then we link to some other resources around online learning events. So we've done a learning session around what does program quality look like in online programs for youth? What does safety look like? We did a separate one around safety. We just last week did one around timely around diversity and inclusion and how to create inclusive spaces when you're in an online environment. So some really good information there as well. So this is if you go to the American, it's acacamps.org is our website, and there's a big button that says COVID-19 resources. All of these resources are open to the public. They're fully available for anyone. So those are there, and if there's anything that's useful, we hope that you will use it. Next slide. So we recognized that we looked back at the swine flu, H1N1 in 2009, and recognized that even if CDC put out guidance, it would be very high level guidance, and that camps and other youth programs would need a lot more specific information to figure out how to operationalize that guidance. And so we engaged a national public health partner, Environmental Health and Engineering. And what they have done is they put together a panel of experts. And so the panel of experts includes physicians, several physicians with connections to the association, the American Academy of Pediatrics, the American, the Camp Nursing Association. They've got folks from the Harvard School of Public Health, a wide variety of health experts, and essentially created this field guide. And so it is, there are recommendations on how to implement the guidelines that come from CDC and then also from state and local areas. So we'll spend a little bit of time talking about some of the themes. This is the resource that I mentioned that is lined up only nearly perfectly with the CDC decision-making tool. So there are 12 different chapters, and there are different sections to each chapter. A couple of important notes. One is that it aligns with the CDC information. Second important note is that we really see this as a living document. And so we have contracted with Environmental Health and Engineering through September. We're actually working on funding to keep them for the whole full next year, because we don't think that the coronavirus is going to go away as we think about youth programs all the way through to at least summer 2021. But right now, we definitely have them funded through the end of September. So they will monitor the ongoing situation, and they will update the guide as new information becomes available, as best practices change according to that new information. So you can certainly download a full PDF of the whole guide. You can go directly to chapters. Even if you download the whole guide, I would recommend that you come back with some frequency and just check to see if information has been updated, and we'll flag it when it's been updated. So that's an important piece. Next slide. So one other useful resource that we've been populating is we have a link on our website that tracks the rules for when and how camp can operate in different states. And there are some times that day camp aligns with other youth programs, and sometimes that it does not. So if you look there in Colorado, guidance for children's day camps and youth sports camps, some of them, there's some overlap there, but this is a resource to see which states have written specific rules, and it links directly to those rules. So we're updating this almost every day. There are about 20 or so states that have not fully published what their rules are yet. So besides having the resource here for you, the other important thing to note is the CDC guidance is simply expert information for reference. Our resources are the same thing. Neither of those is binding. What is binding to you will be the rules that are written by your state. First your state, and then your local county health department. And so one of the things we've done in our engagement with Environmental Health and Engineering is they are connected to a network of state health officers and a network of local health officers. And we've been pushing out information to them about our resources as they have been developed. We have held 2 town hall meetings with our panel of experts specific to health officials to help them understand these guidelines. The thinking is that state folks will have to write rules around lots of different areas, and they may not know youth programs and camping very well. So we wanted them to know there were resources to help them. But even beyond that, local health departments can set rules that are more strict than the state rules. And a lot of them may have risk avoidance. And if they're not that familiar with youth programs, they may just naturally set tighter constraints. And so we wanted to help educate them about resources that were out there and opinions about how you can do youth programs safely in the coronavirus environment. We also held 2 town halls for the general public. The links to all of those town halls are also on our resource. So if you want to hear questions that were asked of our panel of experts, you can go click on those and spend time reading those. There was a robust question and answer, and we had 5,000 people in one of the webinars, and so clearly we couldn't get all the questions answered. So we are working on posting answers to frequently asked questions about the field guide as well. So those are all resources around the specific guide. Next slide. So let's talk about some high-level themes, and I'll be brief here, and we can leave. I'd rather spend time where your specific questions are. I saw some of the questions that were mentioned ahead of time, and I may hit some of those in the overview. So let's talk about some of the themes. These are themes that are specific to our field guide, but they align with the CDC guidance that is out as well. Next slide. All right, these are going to come up one at a time, which is fine. Let's hit the first one. Okay, so the first theme that we have here is protecting the most vulnerable people. So this is the idea that we're really moving from a stage where the goal was to try and stop the advance of the virus. And you know, clearly you do that for individuals, people's safety and health, but you also do it so that you're not overwhelming the health systems. We're now moving across the country, we're moving into reopening, and the CDC frames this as we're really moving from trying to stop the spread of the virus to recognizing that in many people the virus is not high risk, and that the virus is going to be with us until we have community immunity, and that will most likely come in the form of a vaccine. But between now and a vaccine, we will begin engaging in things that look similar to what we did before with some more safety precautions, but we will also continue to protect the most vulnerable folks. And so the CDC has some great links that help you understand who the most vulnerable folks are. Certainly there are folks over a certain age, there are folks with underlying health issues, folks going through chemotherapy, folks who are immunocompromised. So the idea is that those people will probably continue to shelter to a higher degree than the rest of the population. And how does that apply to youth programs? Well, there's a section about that in our field guide, but it has to do with recognizing that as we are holding youth programs, it is likely that we're not going to be successful in preventing the coronavirus from showing up. So it is likely that many programs will have at least one instance of the coronavirus. It's highly contagious and it is out there. So the resources are built around processes to slow and mitigate the spread of the virus if it does show up, and to continue to operate programs because you have good protocols in place and contact tracking, and we'll talk about that in a minute. So what that means is that you need to disclose to your participants that, that there's a chance certainly that they may be exposed to the coronavirus in their programs, and you will want to encourage anybody who is considered a part of the vulnerable population to consult with their physicians and get a medical recommendation as to whether or not they should participate in the program. What's the risk there? You really want to leave that to medical professionals, and then when the medical professional believes that we're able to serve them, we as programs want to do our best to accommodate those people, and that may be having additional considerations for previously identified vulnerable population. We want to accommodate as much as possible and as is reasonable. So the first step is to disclose that there is certainly a risk of exposure, and then ask for a medical consult, and then we will accommodate the best that we can, and we'll add in additional precautions for people who may be vulnerable. Next slide, or next bullet. So screening and monitoring. So there's really three types of screening and monitoring that that we walk through in the field guide. One is pre-screening. And so as you are able, and this depends on the length of your program, whether or not you do this, but as you are able, there's a great link to a protocol in the field guide around how you ask participants to pre-screen at home before they ever come to your program. And so there's a 14-day chart, and they walk through and they check off the chart, and they're thinking about symptoms, they're taking daily temperatures, and they're essentially sheltering at home before they're engaging. So that's one way to catch. Typically in a camp setting, we'll do a health screening as we're doing intake. This is helping people be in the mindset of looking out for symptoms before they ever get to your program. So you ask your participants potentially to pre-screen prior to coming to your program. Then you'll do an intake screening, and for a day program, that intake screening happens every day. Recognizing people are going home to environments we don't have control over, you'll need to ask questions about symptoms, about exposure, and then take a temperature each day upon arrival. And you may do a bit more on the beginning of your program than you do each day, but you are going to want to screen every time people go home and come back. And then we're going to monitor all day long. So you're going to need to educate participants that if they don't feel well, if they have symptoms, that they need to raise their hand and let somebody know. And then, you monitor appropriately. And monitoring changes depending on, in the instance that you have an exposure, then monitoring changes. We'll talk about that in just a second. Next bullet. Here it comes. So, so there are a couple bullets. I'll hit the first one first. Camp as a bubble. So the idea here is your program area. You want to try and isolate that area to the greatest degree possible. So if you're a day program, you have people going home and coming back, and that's both staff and participants. That's why you screen every day. But when you have the community assembled, you're going to want to decrease exposure as much as possible. So you're going to want to decrease visitors. When you think about drop-off procedures, you're probably restricting parents so that they're not getting out of their car, and there are certain procedures that they follow there. As you have deliveries and things to your program site, you're going to want to isolate that from your participants. When you have food service, you're going to want to be thoughtful about the people who are doing the food service, and we'll talk about that when we talk about cohorts. But to the greatest extent possible, you want to make camp be a protected bubble, so that you're not having potential exposures all through the day. That also means that if you typically do field trips into public places, that you might want to eliminate that. So we want to eliminate cross contact with your population with other populations. So you may have to change your program design if it involved going to a local museum or things like that. You may have to switch some of those components to online components, if that's possible. So that's camp as a bubble. And then organize into program cohorts. So this is a recognition, and there are lots of questions about this. This is a recognition that children are not going to be particularly successful about social distancing all the time. So if you have a bunch of 7-year-olds in your program, asking them to stay 6 feet apart from each other is highly optimistic, right? Even in the best of circumstances. So from the CDC draws heavily on this, and they're really using this concept when they're thinking about school as well. You hear about summer school or school in the fall. This idea of having program cohorts. So what you do is you have the smallest possible group that you can get together, and that group stays together through your whole program day. It's what we call in our field guide the household. So essentially you're going from sheltering in place with your household to having a new program household that you join when you go to camp or to your program and during the day. And so how the participants and the staff interact is more similar to home than it is in social distancing. So you think about your house. You're not all staying exactly 6 feet apart from each other. No one's wearing masks typically in the home, but you are doing some precautions. You're washing your hands more than you used to. To some degree, we were cleaning off groceries when they were coming in, or packages. And so it's the similar idea in the program cohort, is that you are going to not share utensils. You're going to try not to share equipment. If you have crayons, you want to have everybody have their own set of crayons if possible. If you do have to share equipment, you want to sanitize between each use. So there are precautions within the household, but it's not social distancing the way it is everywhere else. It recognizes that we may be closer as we move around together during the day. And so you do your morning assembly together, you do your programs together, you eat together. You want these households to stay intact throughout the day. And you do that for a couple of reasons. One is if somebody were to present with symptoms or to test positive, you can contact track very easily. You know who's been in close contact. And so, if that happens when somebody's at home, they don't come back. But then you want to monitor the rest of the participants in that household. And if you were just taking temperatures upon intake, you may take temperatures 3 times a day with this group. So you don't have to necessarily shut the program down, but you increase the monitoring, and you know who people have been in contact with. And then programs can be made up of multiple groups of households. So if you have a program with 50 people in it, and your household group size is 10, you could have five groups of 10, and that's your program of 50. But you have to social distance between the households. So the neighborhood is your group of 50, but you're keeping distance between the households even when you're all together. So you may do a morning assembly if you have enough room that you spread out so that you have your households distancing from one another, but you can all still get the group together in one place. And depending on how your state interprets this, you may have a camp that could be made up of 3 neighborhoods. So you could have a camp or a program of 150 people, even if the maximum group size is 50, you just have to keep those three neighborhoods apart from one another. They're never in the same place at the same time. And then within those neighborhoods, you have this small cohort group. So a lot of questions about what's the group size. So here there are multiple answers to that. One answer to that is your state will set maximum group sizes. Many states have a group size of no more than 10 in the early stages. And then as you move into later phases of the virus, that goes up to 25 or 50. And then as you get in the very end stage phases, it may be 250 or 500. So our guide recommends that you still organize in cohorts, even if you're in a mid phase and your state says you can have groups of 50 together, that you should still keep those smaller households together. Now, you could do 12 instead of 10. There's nothing magic about 10 except for unless your state says that's your maximum group size. But once it's more than that, it could be 10, 12, it could be 14. There's nothing magic about that number, but our panel of experts says you wanted the smallest practicable in your program to maintain your program. So the state will be the first one to set your group sizes. And then within that, there's still good reasons in a program in trying to protect everyone to keep these small household cohorts together. And I think there might be one more bullet. Yes, so your program should have a communicable disease plan. So that is essentially an outline of, here is what we're gonna do if somebody tests positive. A lot of camps have these anyway. Communicable diseases have been a part of camp for as long as we've had camp. And so for smaller programs or day programs, you may or may not have that. But what you need to do is have a plan that basically says, if somebody tests positive or shows symptoms, here is how we're going to handle that. Here's where we're going to isolate them. Here's how we'll supervise them while they're in isolation. We'll let them, we'll contact the parents to be picked up. Here's how long they need to stay home and their recommendations on all of those things from the CDC. Here's how how and when we're gonna contact the other parents of the people in the household, thinking about HIPAA, you have to maintain privacy. Here's when we'll let the public health department know. And so you need to have a communicable disease plan, and you need to contact your local health department and talk through that plan with them. So you want them to, ultimately they're the authority here. And so you want them to agree on communication. You want them to agree on what your plans are if somebody gets symptomatic or test positive. So you want to make sure you have that vetted before your program starts and have had a conversation with your local health department. The more you partner with your local health department, the easier it's going to be for them to allow you to continue to operate your program even if you have a symptom show up. Next slide. Okay, so those are some of the main highlights. We'll keep the rest for questions later towards the end, but that gives you a sense of some of the key points that are in the guidance. I believe that we're going to post this slide deck. This is simply a page that has links to many of the things that we talked about. Gresham put them in the chat, but if you didn't catch them there, these are just hot links to take you to those pages. So I look forward to asking questions. Thank you very much for the time.
Great, thanks, Henry. As a reminder, this webinar is being recorded. A link to the recording and the slides will be shared later, along with all these things that we posted in the chat box as well. Next, we'll hear from Tony Streit, Senior Project Director for YMCAs at the Education Development Center. Tony?
Well, thanks, Leslie. And I also want to really thank Henry and Gretchen. What American Camp Association has been doing is really leading the field and lifting us up at this point where we're all attempting to get back to the kind of care our children need. And so your guidance and your direction at this point is really powerful, and we really appreciate it. I also want to thank National Summer Learning Association. They have been a partner with us in the National Center on Afterschool and Summer Enrichment for 5 years now. And we've been thrilled to work together on this center for the federal government. The expertise that comes from NSLA and also from all of you in this community has been huge to elevate summer as an essential part of childcare in our nation. So happy to be with you. I'm just going to go a little bit through what we're working on and what we have to offer, and then we can get to questions. So just to start out, thanks for this slide. NCAS, or the National Center on After School and Summer Enrichment, is one of the TA centers of the Administration for Children and Family at the U.S. Department of Health and Human Services. And there are a number of TA centers, roughly 9 at this point, that support states, territories, and tribes in implementing the CCDF, the Child Care and Development Fund block grant program right now. CCDF, of course, are the subsidies that are provided for child care to low-income families working and participating in education and job training. So it's that essential support for working families so that their children are cared for. And of course, at this time, it's particularly challenging for our states and providers to continue that support. But ACF and the Office of Child Care, where we work, are working as hard as possible to keep services flowing. Leslie, if you go to the next slide. So at NCAS, the goal is really to help increase families' access to and the quality of after school and summer childcare. And most people, when they hear about childcare, think of toddlers and babies and the usual kind of smaller children. But in fact, 45% of all children served through the federal subsidy program are school age, between the age of 5 and 12. So we really try to elevate that school age community. School age takes place both before and after school, on weekends, during breaks in the spring and fall, and of course during the summer. Summer is a very important time in school age care. In fact, it's an increase in the number of children served every year. Roughly 10% or so more children are served during the summer than the rest of the year. These programs take place in community centers, in family childcare, and in fact in homes around the country. Next slide, please. So our direct support comes from the Office of Child Care at the Administration for Children and Family. And from the beginning of the pandemic, OCC has been working very hard to be as responsive as possible at this point in time. And I'm sharing with you right now the OCC website. I'll post that for you really quickly so that you can access it. So one of the first things that OCC did was contact the states and try to help them in how they're managing and administering the block grants, and giving flexibility in terms of the regulation on those grants as quickly as possible so states could respond. The flexibility has been fairly significant. Of course, it's allowed for the kind of care for essential workers that is taking place now. And OCC is regularly monitoring the states and offering support. The next thing they did was ask all our TA centers to form a task force and to be ready to quickly respond to states in their inquiries on how to effectively continue to administer the subsidy program. And so that task force meets weekly and is offering support at the state level. As Henry said, the states really dictate policy. They're the ones that administer the subsidy programs. Both the federal and the TA centers are here to provide support, but ultimately the states make the call about how programs are supported, and the safety regulations that have to be provided. Next slide, please. So I'm going to give you two links now. So one is to our center overall. This is how you access us off the ACF website. But what I'm showing you on the screen is our resource library. And I think that's what I most wanted to share today, because over the last 5 years, working with NSLA and our other partners, the National Institute Out of School Time and the National Subsidy Center, we've been collecting resources to support school-age care across the country, both the most promising research into practice and the professional development and curricular supports that support quality. So there's a large collection here. It's intended to be recent, within the last 5 years, so the most recent and up-to-date resources. And I know there are a number of references to American Camp Association, but we recently added a COVID search to this. So if you go to the library, you can identify resources that are specific to responding to COVID in the school age community, those approaches that are most important. And this is updating constantly. We're working with a number of national organizations and thought leaders to identify the most promising resources. And I saw that just this week, the Georgia Afterschool Network released their collection of summer learning resources that the statewide after-school networks will be distributing, which I think will be a great support to the out-of-school time world. So, so look to our library for some of those resources. I wanted to call out just a couple that might be useful to folks. If you go to the next slide, you can actually advance past this one. Well, so the first one that I wanted to call out is recently we did a bunch of work around adverse childhood experiences, and I think I hope that you'd agree that these times for our young people are challenging for our families and parents as well. But it's a time to be thinking about trauma-informed care and ACEs, and how we can be watching out for those signs that our young people need additional supports. So there's a number of resources that unpack ACEs, that point to how to diagnose issues and be as responsive as possible at this time. We're excited to see program return, but I think we have to be watching for the potential trauma that children have experienced over these many weeks. Next slide, please. Another item that we're encouraging folks to take a look at is a toolkit that we very recently created on EPRR, Emergency Preparedness, Response, and Recovery. And this is designed to be very user-friendly, a kind of quick guide in PDF form that you can hop through and find both the expectations around EPRR and the resources and tools that are out there. Of course, each of these elements in EPRR are important. Preparing for the potentiality of a crisis, the response to it, and emergency response and recovery, the thinking beyond the specifics of the crisis. So we're encouraging folks to view that tool and use it as they see fit. Next slide. And then this was created last year with NSLA. One of the items that we were really happy to collaborate on. It's obviously not COVID specific, but it is perhaps a useful tool both for providers and families on thinking about how to prepare for summer. Obviously, we still want summer to be fun and engaging for young people, and we want it to effectively support working families. I think this time over these months has reinforced to us that childcare is critical to our nation. It's what allows our families to work, to feel that their children are safe, and to know that they're learning and developing not just academically, but in body, mind, and spirit. So it's just one of the other resources that you can find in the resource library. And we're going to be continuing to look at how to support the field, how to support our states so that their practices are as responsive as possible for providers, for families and children. And so I'm eager to be a part of the conversation now, the questions that you have, and how we can support this return to summer.
Great, thanks, Tony. So now we have some time for questions. If you have a question for Henry or for Tony, please put that into the Q&A box. I have a few that are already in here, so I'm going to try to go through some of these, as well as some of the questions that you submitted when through the registration process. So to get us started, there are a couple of questions, 2 or 3 questions in here about liability. So can you be held liable if a staff member or child in the program contracts from one another? What are some examples of liability language to include in registration forms? That kind of thing. So any thoughts or resources to share on liability?
Yeah, so I'm happy to jump in here. I answered live, I'm not live, but I answered one question. I think it pushes the answers out to everybody. For a liability waiver, the best ones that we've seen, the Redwoods Group, which is an insurance company, has a variety of COVID-specific liability waivers. So I put that link in the in my answer, but that's a great place to look for. I think a lot of organizations are coming up with specific disclosure language around COVID-19, and I think that that's probably recommended. I think that the real recommendation here is to have a conversation with your insurance carrier, and if you have a larger organization, your risk management staff. I think you're going to want to walk through this specific to your situation. Generally, as we have talked to insurance companies, what they have said is certainly there's some risk involved. There's risk involved in the programs we do all the time. They are having trouble picturing, especially if you're at a day program, how anybody could attach contracting the virus specifically to your program. So there's a high wall to get over, which doesn't mean that some people won't try and do that. And then the last thing I'll say about this is I do know that as there was the CARES Act. There is another act that's being worked on called the HEROES Act, and there's been some discussion about having a general liability exemption for businesses specific to the coronavirus, because so many businesses are concerned about opening up and having this, taking on this risk individually. And in the interest of reopening, just waiving liability generally through a legislation. That is only an idea. And everybody has not agreed to that idea, and that idea is not law yet. And so just know that there is some discussion. You want to keep an eye on that. In the short term, I think what you want to do is speak specifically to your insurance company and your risk management folks and determine how you're going to mitigate any risk there. And Tony may have some additional information.
Great. So we have some questions about group size and adult to youth ratios, who's included in that. So we're seeing some questions. Is it the adult to youth ratio? Is it 1 to 10, 1 to 15? Group sizes varying. and then just who's included, who should be included in those ratios as an adult. So for example, if you have counselors in training, would they be included as youth or adults? So any thoughts around both the ratio size, the ratios, different variations on the ratio, and who should be included?
So I can jump in and say that group size is set by minimum group size or maximum group size is set by your state. And most of those in the early phases are thinking about the groups no longer larger than 10. I know that I think it's New Mexico said that you couldn't have a group size of larger than 5, and it had to be a 5-to-1 ratio. That's the only state I'm aware of where there's that specificity around ratios and group sizes. So the maximum group size will be set first by your state. If you're following the cohorting model that's in the field guide from Environmental Health and Engineering, there's not a magic number on the group size. You need to follow whatever your state regulations are. But if we're working on the assumption that those group sizes will increase as the summer goes on, we still are recommending that you keep a small group size. Could be 8, could be 12, could be 14. There's no real specific on the size. It's the mechanics of being able to contact track and to mitigate spread is the benefit of that. So, you know, if you have a smaller program and could have group sizes of 8, that would be better than having group sizes of 16. And the group sizes include anybody in the group if you're using a cohorting model. So it would be staff, it would be campers, it would be counselors in training, anybody that stays in that household and travels throughout the day is who's within that group. So we don't have any specific recommendations on ratios. That really is more of a program design question, and what you're trying to accomplish and how many folks that you will need for that. Clearly, you're going to want to have supervision, but the ratio is not specified because the intent is to be able to manage the spread of the virus and mitigate that as much as possible. And so the ratio doesn't really matter there. It's that you keep it intact. There was another question, I'll go ahead, that's related to this. I saw in the chat that or in the question and answer. So there was some question about what about program specialists that need to come in and do something with a household. So you may have 5 households, but you have one program specialist that's going to spend some time during each day within those, with each of those households. So there are allowances in this program design, this cohort model for that. And basically what it says is if you have specialists that come in, the best thing to do is to distance the specialist from all the participants in that household and the staff. Where distancing is not allowed, you're not fully able to do that. So in some instances, and a good camp example is, you know, you may be giving archery instruction and you have to help somebody with how they're holding the arrow. That's going to be much easier if you're in closer proximity. Then the specialists will need to wear masks and protective equipment, not necessarily the face shields, but masks in particular, and in some instances, gloves as well. So when you're not able to distance those specialists, and that also includes with food service. So if you have food service staff, the best type of food service, there's a whole section on food service, but if you are providing food, the grab and go food is the best. That's already prepackaged. Where you can't do grab and go, you want to avoid, you know, kids grabbing serving utensils. So you probably want a staff member there plating stuff for folks. And again, that's going to bring some people outside the household in closer contact with the household. Those people should wear masks. And so the program design is intended to allow the participants not to have masks on all day, anybody, staff or participants within that group size. But specialists or other people that have to come in closer proximity will need to have protective equipment. And if you have households that have to get closer than you would like them to, and especially if you're indoors. So outdoors is better than indoors on the spread of the virus. If you're serving food indoors, you're going to want to have space between your households. Where you're not able to have as much space, people do need to have the protective equipment on, masks on. And so that's a little bit about group sizes and about who wears masks and when. Hopefully that's helpful. Maybe we had a couple of stone.
Yeah, there was a few just questions about masks and the feasibility of being able to monitor children wearing masks. Hopefully that addressed those questions. And recommendations on child safety programs like Ministry Safe and background checks. Where can we find this information?
I didn't fully hear that question. Sorry, you were breaking up a little bit.
Sorry about that. They had questions about child safety programs and background checks, where they can find information on that.
So again, I would, and Tony may have more specific information. I think that your normal background checking protocols are still in existence, where we have adults in a delivering program, or either young adults delivering program to children. Background checking is still appropriate, and you would do that in the normal way that you would do your program. There's a lot of questions about whether or not you do that background checking for virtual programs. I would, and there's different information out there about that as to whether it's required. I would certainly recommend it, whether it's required or not. Whenever you have adults in proximity to children, even virtually, there's risk involved, and you're going to want to do background checks. And so there's nothing about the coronavirus that has specifically changed that. The challenge might be timelines. So background checks are handled very differently from state to state to state. And in some states, there's a pretty rapid response. And so you could hire 1 week, and by the next week, you could have everybody background checked. Other states, there's much longer lead time. Some states have provisional employment during that lead time. You're really going to have to check on your specific requirements within your state there. And Tony, please add if you.
Yeah, I'd echo the same thing, that background checks are an important part of safety programmatically. OCC did offer some flexibility to the states, but the states still determine the process for background checks. And so I would, again, look into it, and as Henry said, look into it as soon as possible, because sometimes it's there's a significant lag in it. The other area of flexibility was in terms of ratios. But the state still determined. So look to your child care agency for guidance on that.
We have some questions about protocols for other usual, like routine activities, things like restroom breaks or so any recommendations or protocols for those, both transport and other routine things like restroom. Yes.
So I heard restroom and I heard transport. Those are was there another key one you wanted me to address?
No, those were the two.
Okay, good. So you're breaking up a little bit, so we're getting bits and pieces. Yeah, so transportation, and again, I think I answered one of these in the Q&A. There's a whole section in the field guide around transportation, and you will not be surprised, I don't think, by the recommendations there. You're going to want to fully sanitize whatever the vehicle is that you're using. Clearly, vehicles that have surfaces that are easier to clean are better for use. Where you have cloth surfaces, the sanitation can be more involved, and so much as you have control over that, a school bus, clearly you can clean those seats. That's been designed that way pretty well. And then the best thing to do is to distance while you're on the vehicle, and so that probably means not filling every seat and having people space out within the vehicle and maybe running more vehicle trips. Recognizing that won't always be possible where you're not able to distance on the vehicle, that then the people on the vehicle should have masks on, and they should use good hand washing protocol when they get off of the vehicle. So as they're touching surfaces and stuff, and really, we're all going to be washing our hands a ton and sanitizing a ton. That's probably true in many of these things, but where you have transitions, you're going to want to do that. It's just a part of the program. And so those are the big recommendations around transportation. Again, look at the field guide. There may be I'm certain there are additional specifics there. Restroom breaks, I think that, again, it will be a similar application of the same thing. So depending on how you normally manage restroom breaks, what is the opportunity to do that in a way that it doesn't put people in close proximity to each other? and staff. If you're within the household, then you don't have to distance as much. You can supervise restroom breaks just like you always have. Certainly, significant hand washing will be a part of that. And so, if you're outside of the household, like if you have people that are monitoring restroom breaks that are not a part of these cohorts, then, the protective equipment on those staff that are doing the supervision would be helpful.
Thank you. Tony, any other specific guidelines for childcare centers that people should look for?
Well, I think Gretchen shared, really ACF and Office of Child Care has looked to CDC to make the guidelines. So the initial ones came out in April. Those were around child care programs that continue to provide service to essential workers. That came out April 21st, and Gretchen may have posted that. And then the more recent summer one is the one that Henry and ACA have kind of built their guidance around. So it's really CDC that's offering kind of the direction in terms of the appropriateness. But again, each state interprets it in its own way, and depending on the severity of the pandemic in the state and the nature of summer programming across the state, whether it's urban or rural or other settings. So we really encourage people to look local first and then look to the federal for additional support.
I think we have time for maybe two more questions. So here's one, just to reconfirm, if someone within a cohort tests positive, it's not necessary to send the entire cohort home to isolate. Any discussion regarding policy of refunds if someone tests positive and cannot attend? And what is the requirement when someone who tests positive returns to your program? So general question about the procedure around if somebody tests positive.
Great, yeah, so this is, the million-dollar question. And we get this question a ton in all of our different groups, and there's not a really satisfying answer because it depends on lots of different variables. So I mentioned having a communicable disease plan that maps out how you're going to respond if somebody either shows symptoms or tests positive. It's important to map that out, and it will depend on your ability to isolate. It will tend to depend on your proximity to parents and their ability to pick up. There are lots of variables, and it also depends on the comfort level of your local health department. And so the guidelines are written based on a public health model called concentric circles of protection from infection. That's what these cohorting model is built on. That's a well-established model of preventing the spread of infection. That doesn't necessarily mean your local health department agrees with that. And so having a conversation about what happens when somebody tests positive with your local health department is going to be critical, because a local health department may say, you got to close the whole program for 14 days. Well, if you can educate that person and provide some resources and show how you're doing cohorting and significant contact tracking, and you may be able to build some confidence that if you increase monitoring by X, that you could move on with the program. And so the program is designed so that you don't have to send everybody home and close the program, but your local health department official is going to have to let you know what their comfort level is. And so that's going to dictate what happens more than anything, really. As far as refunds, so having a plan and having that discussion will be critical. As refunds, that's going to be individually up to you. If it's on if it's 3 o'clock on the last day of the program, it's different than if it's the 1 hour into a 2-week program. We're encouraging our camps, our member camps, to be as liberal as they can in having refund policies. Clearly, everybody's been impacted by this virus, and organizations are feeling that impact too. But if you really want to maintain the relationship for the long term with these families, and therefore being as accommodating as you can, but that's really, that is up to you. There's a little bit in the press now about some camps that are not able to operate, and and that are trying to strongly encourage parents to roll that forward. And so you may read some articles about that. We really think that you ought to be as flexible as you are able to be. And you know, you'll want to be clear on what your refund policy is if the program has started as well. And, you know, it's reasonable to say I could have filled a position and now I can't. And so, you know, we're going to prorate it or there won't be a refund, but be clear about what that is and disclose that on the front end of the program. But we just would encourage you to be thoughtful about maintaining relationships over the long run. So I think that those are the thoughts that we have. Tony, you know, you're welcome to jump in as well.
I just say, I know we're running out of time, but I would just say, you know, this is a time to really elevate and increase your communication and engagement with parents and families. They've, as you know, we've all been struggling through this and they've been struggling through it. And so the more you can be in communication, the more you can have them be a part of your own needs assessment will make sure that there's, you know, a successful program, particularly around, you know, maintaining that children are healthy and able to participate.
Great. Thank you so much, Henry. Thank you, Tony. And thank you to everyone who joined us today. Just a couple announcements to wrap us up. Look out for more in our Voices of Summer series. And also look out for National Summer Learning Week. This year will be July 6th through 11th. We will be having some virtual events and celebrating and advocating the power of summer. Also look out for more announcements about that. And be sure to follow us on social media. That's the best way to hear about new announcements, new events, and resources. You can sign up for our newsletter and join special cohorts of peers interested in special topics like sports, literacy, youth employment. You can also find out more about NSLA's consultation support and technical assistance for your summer program. Thank you again. And as mentioned, a link to the recording and the slides and all these links will be shared with you. Have a good day.
Thanks so much.
Bye-bye. Thanks, everyone.